Today we will talk about the examination of the abdominal lump. So the steps involved in the lump examination is inspection, palpation, and the auscultation. So before starting the examination, first of all, you should introduce yourself to the patient, take informed consent from the patient, explain all the steps of the examination to the patient, and always approach the patient from the right side, and then expose the patient properly. And the patient position is the supine position. So the first step in the lump examination is inspection. And inspection look for the site of the lump, size of the lump, and the shape of the lump. Also look for the overlying skin changes on the lump. That is any redness, pigmentation, or stretch marks on the lump. And also note for any visible vein. Also note the movement of the lump with the respiration. And also look for any visible peristalsis which indicate the obstruction. The second step in the abdominal lump examination is palpation of the lump. First of all, warm up your hand, check the temperature of the lump with the back of your hand, and then superficially palpate the lump by looking at the face of the patient to check for any tenderness. And after superficial palpation, deeply palpate the lump for the shape, whether the lump is rounded or globular in shape. Also, check the surface of the lump whether it is smooth or not, and also check the margins whether the margin of the lump are regular or irregular, and also look for the check the consistency of the lump whether the lump is soft or hard. Measure the size of the lump with the help of inch tape, both the lengthwise and the widthwise, and also check the movement of the lump with the respiration by placing the hand around the swelling and ask the patient to take a deep breath and look whether the swelling moves with respiration or not. Then perform the skin pinch test over the lump to check whether the lump is attached to the overlying skin or not, and also perform the transillumination test with the torch to look for any cystic swelling. Then perform the fluctuation test, and fluctuation test is done by placing the two fingers over the swelling perpendicularly and press over the lump with one finger and peel the lump with the other finger that are placed perpendicularly to each other, and also peel the pulsation over the lump by placing the index finger around the lump, and the pulsation indicate that the lump is vascular in origin. And then perform the slip test. The slip test is done for the lipoma, and it involves pressing over the lump with the index finger and look whether the lump slip toward the opposite side or not, and the slip test is positive in lipoma. Then we perform the two special tests. The first one is the head raising test. So head raising test is done for a lump present above the umbilicus by asking the patient to place both hands on the chest and raise his head. So the swelling that are superficial or parietal, they become more prominent, whereas the intra abdominal lumps, they become less prominent. So in head raising test, we ask the patient to raise the head, and we look for the swelling whether it become more prominent or less. The second one is the Carnet test. So the Carnet test is done for a lump present below the umbilicus, and we ask the patient to raise his leg, and we notice whether the lump become more prominent or not. So the swelling that is superficial become more prominent, whereas the swelling that arises from the intra-abdominal viscera, it become less prominent. So there are two special tests. One is the head raising test. It is done for lump present above the umbilicus, and the second one is Carnet test. It is done for lump that is present below the umbilicus, and we ask the patient to raise his legs. Then also check whether the swelling is pulsatile or not by placing the index finger around the lump and feel the pulsation, which means that either the swelling arises from vascular origin or not. And the third step in the lump examination is auscultation. So auscultate over the lump with a stethoscope or any vascular buoy, and at the end call the patient and say thanks. So it was all about the examination of the abdominal lump.